Hi, my name is Sam Most, and I'm excited today to share with you a bit of an overview of my new textbook, Comprehensive Rhinoplasty, Structural and Preservation Concepts. Now, this is the first book that's been published that really synthesizes and fuses all the concepts around structural and preservation rhinoplasty, and so that's one of the reasons I'm so excited about it. It's a summary of over 20 years of experience, and it is available with quality medical publishers at this website, and we're very thankful. It's gotten some really rave reviews, including a 5-star review from Aesthetic Surgery Journal. And so we're going to go over some of it. The goal of this is not to comprehensively cover this textbook. That's impossible. But really to give you an idea of what's in it and to give an overview. And so this video covers several of the parts of the book. Part 1 is Principles in Planning. Part 2 is Primary Rhinoplasty, Structural and Preservation Concepts. Part 3 is Revision Rhinoplasty. And Part 4 are special topics such as non-Caucasian rhinoplasty, grafting, and so on, crooked nose, for example. And finally, Part 5 is several case studies. Now, this textbook has hundreds of illustrations and figures. In addition to that, accompanying the textbook are 4 full video cases, including 2 full preservation rhinoplasty cases and 2 comprehensive structural rhinoplasty cases. So throughout the textbook, you'll find structural and preservation concepts coming together. So let's dive into part 1. And I'm going to go through the chapters, just give you an overview of what's in these chapters really briefly. Chapter 1 is Surgical Anatomy for Structural and Preservation Rhinoplasty, and these are my co-authors. I'm very thankful for them. Now, it's impossible to go over all of it. I'm just going to make a few highlights here in this video. And first is, when we're looking at a person's face, we're looking at their profile, their base view, their frontal view, of course, 3/4 view, which are not shown here. These are some of the highlights of the external landmarks that we look for from the side. From the front, one of the main things we look for is of course, the dorsal aesthetic line contour, the symmetry. We also look for tip contour, and base view, we look for symmetry and alar tip lobule contour. Now, when it comes to structural or preservation rhinoplasty, understanding the anatomy is really important. A few of the concepts, most of the osteotomy work that we do are along the ascending process of the maxilla. The upper lateral cartilages and the septum both extend underneath the nasal bones. That's under the area called the bony cap. We think of the nose in the upper third, middle third, and lower third, roughly corresponding to the nasal bone structures, the middle vault structures of the upper lateral cartilage and septum complex, and the tip complex. A concept that's I think important for both patients and rhinoplasty surgeons to understand is that the skin varies in thickness across the dorsum. We talk about this later in some of the other chapters in more detail, but basically it's thickest at the highest area and at the area just above the tip in the supertip area, and thinnest over the rhinion. And this is important when you think about preservation rhinoplasty because we're preserving those structures at the rhinion area in order to prevent irregularities that can become visible with standard resective techniques. The dorsal aesthetic lines are formed by that fusion of the lateral keystone area and the dorsal keystone area coming down, and this is a dissection that shows just how beautiful those contours are, and this is what we really want to preserve in preservation rhinoplasty. Sometimes these are simply not preservable, and those are cases where we transition back to resective techniques. And so my philosophy in general is to do whatever is best for the patient and not necessarily feel like I have to do one technique or the other in every single patient. And I think that's something that's important to understand. When you look at the nasal bone contours and dorsal humps, Lazovic published a really nice paper that described a V-shape versus an S-shaped hump, and these are some dissections kind of showing that. Applied anatomy in dorsal preservation includes understanding how the V-shaped or S-shaped humps look, whether you can convert an S-shaped hump to a V-shaped hump and make it more favorable for dorsal preservation. Outlined below is what I mentioned earlier, that the upper lateral cartilages extend underneath the nasal bones. And that's an important concept, particularly in preservation and if you're converting an S shape to a V shaped hump. When you look at cross sections of the nose, and we're going to talk more about the specifics of preservation rhinoplasty bony techniques later, we know that the internal nasal valve area can be narrowed due to pressing in of the bones and the lateral sidewalls in push down rhinoplasty versus let down rhinoplasty. And these dissections just kind of give you an understanding of why that occurs. And when you look at the nasal septum, it's important to understand the variations in the length of the quadrangular cartilage, the definition of the point at which it ends underneath the nasal bones called the ethmoid point, which I think was described by Miguel Ferreira, my colleague. And so these are all important considerations when we think about doing dorsal preservation. For example, if somebody has a very anterior ethmoid point, in other words, a very short quadrangular cartilage, then in those patients we may decide it's more difficult to do preservation rhinoplasty. And if you're starting out, that maybe isn't a patient to choose. And if you are an expert, you have to understand what the limitations are, what you can do, and what the pitfalls are with regards to work on the perpendicular plate of the ethmoid. This is a diagrammatic representation of what happens with the modified subdorsal strip technique, which is one of the methods. It's my preferred method for dealing with the septum in dorsal preservation rhinoplasty. And so in the textbook, we highlight the way the cartilage cuts are made and how the dorsum is flexed down into a straighter position. One of the important concepts is the idea of the dorsal septal gap, and that is the distance between the septum and the nasal sidewalls underneath the bony hump. It's not always midline, as shown on the left. So if somebody has, for example, a crooked nose and the arrow points in the direction that you want to move the nasal bones, the middle option, if it occurs, is favorable because the bones tend to fall in and not to fall out. Whereas the one on the right shows an unfavorable dorsal septal gap configuration, whereby the high septal deviation makes it difficult for the nasal bone to fall the direction that you want it to. These patients, if you can detect this prior to taking down the dorsum, are better candidates for dorsal preservation. Another important concept that my colleagues have described and is shown here in some of these dissections is the resting angle, which is the plane between the upper lateral cartilage and the lower lateral cartilage, shown on the left, and the intracrural angle, which is shown on the right. And so when we're doing tip work, which we describe later in these videos, and which we talk about in the textbook at length, these are important concepts to understand, and these are things that we're going to manipulate in order to get better tip contour. Understanding the ligamentous structures of the nose is also very important, and these are things really in the past 5 to 10 years have been really described nicely by Peter Palazzi and others. Very nice anatomical dissections that they've performed describing various ligaments. And here we just show a diagram of the Patengi ligament as it descends down in front of the septum. It becomes part of the membranous septum. And understanding its importance in tip support mechanisms is really paramount. And also understanding the angle between the caudal septum and the posterior portion of the medial crus, which is something that we described. The angle of divergence, or the septal crural angle of divergence, is important to understand when considering tongue and groove maneuvers and other things like that, which are my preference for manipulating tip projection and rotation. So the key points of this chapter were that while patients care about surface contours, the surgeons must understand the underlying anatomy. There are very complex relationships between all the cartilages and the bones. And the lateral key area is important, particularly in considering dorsal hump reduction techniques. And the dorsal key area is where the upper lateral cartilages and the nasal bones overlap. The ethmoid point, which I mentioned earlier, is the posterior superior point of the quadrangular cartilage and defines how long your nasal septal cartilage is, particularly how far it extends underneath the dorsal hump. And Patengi's ligament is a complex structure involved in tip shape and support, and it's just really beginning to be understood and something that sometimes we preserve. I hope you enjoyed that overview of Chapter 1. This book, again, is available with quality medical publishers. It's the first book on structure and preservation, and I hope you enjoy it.